All right, so you know how much we've been talking about aggressive client behavior as mental health professionals, and clearly you're all really feeling this based on what we've been seeing.
Absolutely.
So I mean, it's such a heavy topic, right? And you've shared some like really intense situations. And it's just so clear to me reading through everything how important it is for you to feel prepared if something like that were to happen. You know, one story that really stood out to me when I was reading through your materials was about Jamie, a therapist working with a court-mandated client.
Hmm.
And it seemed like everything was fine, going okay. And then bam,
Yeah.
out of nowhere, he like shoves this table across the room.
Oh, wow.
Papers go flying everywhere, and then he just unleashes this tirade about, the justice system. And I mean, it's a stark reminder that even when you think you're in a controlled setting,
Violence can just
that goes
go away
sideways.
so quickly.
Yeah. And, what's so important for us to unpack here is not just the physical act of aggression, right?
Right.
Like, obviously, that's a huge deal, but it's the ripple effect.
Yeah.
The emotional impact on both the client and the therapist is so significant, and it really shouldn't be underestimated.
It makes me think about the warning signs. Like, are there things that we as practitioners, as therapists, can learn to pick up on? I mean, I know in the research that you sent me, there were definitely some red flags listed,
Right.
but, some of those felt a little obvious. Like, if someone's showing up to your office, disheveled or, God forbid, with a weapon, I mean, that's,
Thankfully.
thank goodness, pretty rare.
Yeah, those are like the extreme cases,
Right.
right?
What's probably more common and honestly often trickier to spot are the subtle shifts in a client's just demeanor that might precede an outburst. So it really is kind of like being a detective,
Oh, interesting.
looking for those clues. Yeah.
So, okay, so we're talking less about like a literal weapon, right?
Right.
And more about just like their, I don't know, presentation.
Precisely. Like, let's take appearance, for example, right?
Yeah.
So while a disheveled look could signal something's off, a sudden drastic change in their usual attire, that might be more telling.
Okay.
So, if you have a client who always dresses meticulously,
Right.
they show up, disheveled, not put together, that kind of inconsistency could be a red flag.
Oh, so you're looking for that deviation from the baseline,
Exactly.
not just like a one-off, oh, they look a little rough today.
Yeah, exactly. And then, I mean, mood is a huge one too, right?
Of course. Yeah.
Increased anxiety, irritability, emotional volatility. These are all potential indicators that their internal world is out of balance.
Mhm.
And it's not just what they're feeling, but how they're expressing it.
Oh, interesting.
Right.
So someone who's normally quite reserved is suddenly like overly talkative or just like really agitated.
Exactly. Or someone who's, not usually prone to emotional outbursts suddenly becomes very reactive.
I see.
Another area to really pay close attention to is their physical behavior.
Okay.
Are they fidgeting more than usual? Is there increased pacing or hand-wringing? Even subtle changes in eye contact,
Oh, interesting.
like intense staring, or conversely, avoiding your gaze.
Yeah.
Those can all be very telling.
You mentioned speech earlier, right, as a potential warning sign.
Mm-hmm.
But I feel like we focus more on the content.
Right.
But are there like nonverbal cues in how someone is speaking
Oh, for sure. Absolutely.
that we should also be attuned to?
Yeah, definitely. So a sudden increase in the volume or pace of their speech, even if the words themselves aren't aggressive, that can be a sign
Interesting.
of escalating emotional arousal. And pay attention to their tone of voice. Are they becoming more sarcastic, condescending, clipped? These can all be signs of, building frustration.
It's interesting because it sounds like we need to become incredibly attuned to even like the smallest changes in a client's behavior, right?
Yeah, it's subtle, but it's really
But
important.
what is it that's driving these shifts?
That's the million-dollar question. Because it can't just be about having a bad day, right? I mean, we all have those, right?
So what's going on beneath the surface?
You're right. There's always a deeper reason. And think of it this way. Aggression, whether it's verbal or physical, it's often a symptom of emotional dysregulation.
Okay.
It's the body's way of expressing an overwhelming feeling it doesn't know how to process.
Okay. So emotional dysregulation. So it's not that the client is choosing to be aggressive.
Yeah.
It's more like their emotions are kind of hijacking their behavior.
Exactly. Imagine it like this. Their emotions are a pot of water simmering on the stove, okay?
Okay.
Stress, trauma, mental health conditions, life circumstances, all of those things. Those are like turning up the heat.
Mm-hmm.
And eventually that water is going to boil over.
And that boiling over is what we're seeing as the aggression. So then as therapists, how do we help our clients, like, regulate those emotions before they reach that boiling point?
That's where the real work comes in.
Yeah.
And it's why understanding the underlying causes of a client's dysregulation is key. And that's where your expertise as a mental health professional comes into play.
Okay, so let's dive into that then. What are some of the most common factors that contribute to this emotional dysregulation in our clients?
Well, I mean, when we think about the root causes of emotional dysregulation, there are a few key areas that often come into play.
Okay, so walk me through it. Where do we even begin to unpack this with our clients?
Well, a really good starting point is exploring their history.
Okay.
Trauma, particularly childhood trauma, that can leave these really deep-seated emotional scars that make it incredibly challenging for people to regulate those intense feelings. Right.
It's like their emotional thermostat has been wired differently.
It's almost like even years later, a seemingly small trigger can just send them spiraling back to that place of fear or vulnerability.
Exactly. And it's not just about the traumatic event itself. It's how it was handled at the time.
Right.
Did they receive support and validation? Or were those feelings minimized, dismissed, even punished?
Which kind of brings us to mental health conditions, right?
Yeah, yeah.
Because I imagine those also play a pretty significant role in how someone processes and manages their emotions.
Absolutely. Conditions like anxiety, depression, PTSD, borderline personality disorder, these can all significantly impact a client's ability to regulate those emotions effectively.
So, for instance, someone with anxiety might be hypersensitive to perceived threats, which would then lead to a quicker escalation.
Yeah.
Yes, exactly. They're already on high alert.
Right.
And then those with PTSD might have those intense emotional flashbacks triggered by, certain stimuli, certain things that remind them.
Yeah.
It's like their nervous system gets stuck in that fight or flight mode.
Exactly. Yeah. It's like that switch just gets flipped.
Exactly.
And then on top of all of that, you have the day-to-day stressors, right?
Absolutely.
And the life circumstances that can then further amplify that dysregulation.
Right. Because it's not just...
It's like a compound effect almost.
It is. It is. Think about it. Job loss, relationship issues, financial strain, grief,
Yeah.
or even, positive transitions like starting a new job
Oh, interesting.
or moving to a new city.
Right.
Those can all throw our emotional equilibrium out of whack.
Because it's still a change.
It is. It is.
Yeah, absolutely. It's like everyone has their breaking point.
They do.
And sometimes life just keeps piling on the pressure until, well, I mean, we've all seen how that manifests in the therapy room, right?
Exactly. And it's important to remember that clients don't come to us in a vacuum.
Right.
They
Right.
bring their entire life experiences, both past and present, into that therapeutic space with them.
Which makes me wonder, how do we as therapists, how do we react when we're confronted with those really intense emotions, especially in the heat of the moment?
Right.
I know in the material you shared with me, you talked about some common reactions.
Right. And these reactions are completely human,
Oh, yeah.
even instinctive. And we have to remember, as therapists, we're not immune to feeling overwhelmed or triggered ourselves.
Of course not. So let's talk about those reactions a little bit.
Yeah.
I remember there being 4 main ones.
Mm-hmm.
So can you walk me through those?
Sure. So the first, and maybe the most intuitive, is anger.
Okay.
When someone's being aggressive toward us, it's natural to feel a surge of anger in response.
Right. Especially if you feel personally attacked or unjustly blamed.
Exactly. It's that primal fight back instinct kicking in.
Right.
And while that feeling is totally valid, it's usually not super helpful to act on it directly in that therapeutic setting.
Right. Of course. Keep it professional.
Exactly. Remember, our goal here is to de-escalate the situation, not to escalate it further.
Right. Then there's appeasement.
Right.
Which I imagine stems from this desire to quickly defuse the situation, even if it means compromising our own boundaries a little bit.
Precisely. And while it might seem like the path of least resistance in the moment.
Right, let's just smooth things over, get through this.
Exactly. Appeasement can really backfire in the long run.
How so?
Because it can create this dynamic where the client learns that aggression gets them what they want.
Oh, I see.
And that's not conducive to their growth or, frankly, the therapeutic process.
Right, so no more, giving in to unreasonable demands just to keep the peace.
It's about finding that balance between empathy and firmness.
Right.
Right. So validating their feelings doesn't mean we have to give in to every demand.
Okay.
We can still set healthy boundaries while acknowledging their experience.
Okay, I'm starting to see how tricky this whole thing can get.
It's a dance, for sure.
Yeah.
Yeah.
Yeah, it really is. Okay, what about avoidance?
Right.
Because, again, it's only natural to want to, like, distance yourself from a source of stress or discomfort, right?
Absolutely. And in some cases, physically removing yourself from a situation is absolutely necessary for safety.
Right.
But consistently avoiding a client or even just their emotions,
Right.
that can be really detrimental to the therapeutic alliance.
Because if we're constantly, like, tiptoeing around their triggers or shutting down conversations that feel difficult, they're going to pick up on that, right?
They will.
And then they're going to feel like they're not being heard or seen for who they are.
Exactly. They might also start to believe that their emotions are too big, too scary, or just too much for us to handle.
Right. Which can lead to, like, further shame and withdrawal, which is the opposite of what we want.
Exactly the opposite of what we want.
Okay. And then that leaves us with the last reaction.
Yeah.
Inconsistent care.
Yes.
So what exactly does that look like?
So inconsistent care often happens when a client's aggression is met with kind of like a hodgepodge of responses from different staff members.
Okay.
Right? So maybe one therapist is more avoidant,
Right.
another leans towards appeasement, and then another one tends to react with, more anger.
So the client is getting all these mixed signals,
Exactly.
which just adds to their confusion and their anxiety.
Exactly. It's like playing a game where the rules keep changing.
Right.
And this unpredictability can make it so challenging for the client to feel safe, understood, and able to trust the therapeutic process.
It sounds like each of these reactions, while, completely understandable, can have some pretty unintended negative consequences.
They can, for sure.
So what's the alternative? How do we move from a reaction to a response, especially when we ourselves are feeling really triggered or overwhelmed? So we've talked about the common reactions to client aggression.
Yeah.
But how do we actually shift from just reacting to responding effectively? That feels like the real question here, right?
It is. It is. And the good news is there are concrete strategies that we can implement, both in those high-intensity moments and then also long-term.
Okay.
So think of it like having a toolkit, right?
Okay.
You want to be equipped with a variety of skills that you can then draw upon depending on what the situation calls for.
I like that analogy. Okay, so what tools should every mental health professional have in their toolkit for managing aggression?
So let's start with those immediate, in-the-moment tactics. So these are your go-to strategies when a client's emotions are escalating and you need to quickly de-escalate the situation.
Okay, so like those critical moments where it's just like really feeling heated.
Exactly.
What's our first line of defense?
Well, first and foremost, obviously your own safety and the safety of those around you is absolutely paramount.
Right, of course. But like in that moment when someone is yelling, it's so easy to like freeze up or get flustered.
Right.
So are there specific techniques that can help us like stay grounded, stay responsive, even when like our adrenaline is pumping?
Absolutely. One technique I find really helpful is grounding.
Mhm.
And it's basically about bringing your awareness to your physical body and to your senses. So you can try taking a few deep breaths, noticing the feeling of your feet on the floor, even just focusing on a neutral object in the room.
It sounds like almost too simple.
It can be really helpful, though.
But I can see how that shift in focus could help interrupt that initial wave of like panic.
Exactly. It's about buying yourself those few seconds to regain your composure and respond thoughtfully, rather than just, reacting impulsively.
Right, right. Okay, so once you're feeling a little bit more grounded, then we can focus on actually de-escalating the client's emotional state.
Exactly.
And how do we do that? I imagine active listening is a big piece of this.
Huge. Active listening is so crucial in these moments. It's about conveying to the client, both verbally and non-verbally, that you are fully present and you are attuned to their experience,
Right.
even if you don't necessarily condone their behavior.
So like making eye contact, nodding your head, using phrases like, I hear you, or tell me more.
Exactly. But active listening goes beyond just reflecting back their words.
Hmm.
It's really about tuning into their emotions, their body language, and trying to understand like the underlying message they're trying to communicate.
That reminds me of something you mentioned earlier, validation.
Yes.
How does that fit in here?
Validation is incredibly powerful. And it's really about acknowledging the validity of their feelings, even if you don't agree with their actions.
Okay, so for example, if a client is furious about a medication side effect they're experiencing,
Right.
we can validate their frustration, their anger, without necessarily agreeing that the medication is the wrong choice.
Exactly. You might say something like, I can see that you're really angry about how this medication is making you feel, and it's completely understandable that you would be upset.
Right, so it's about, like, separating the emotion from the behavior. So we're validating the emotion, but that doesn't mean we're condoning aggressive behavior.
Exactly. And then once you've validated their feelings, you can gently start to guide the conversation towards problem solving.
Which I guess leads us into those long-term strategies you were talking about.
Great.
The things that are going to help us build resilience and navigate these challenging encounters with more, like, confidence and grace.
Right. Because let's be honest, dealing with aggression, even when we're equipped with those in the moment tactics, it can take a toll.
Oh, yeah. It's
Mhm.
emotionally draining.
Absolutely. So it's vital that we as therapists prioritize our own well being.
Yes, 100%.
Yeah.
So what are some self-care practices that can help us kind of stay grounded and centered, especially when we're working with clients who are prone to aggression?
Well, honestly, mindfulness meditation can be a game changer.
Yeah.
Yeah. It's about learning to observe your thoughts and feelings without judgment, which is so helpful when you're feeling really triggered or overwhelmed.
Right. So instead of getting caught up in like our own emotional reactions, we can kind of create some space between the trigger and our response.
Exactly. And it's like building a muscle.
Hmm.
The more you practice mindfulness, the better you become at regulating your own nervous system, which then allows you to show up for your clients with more calmness and composure.
And I imagine that sense of calm can be like almost contagious in a therapeutic setting.
Absolutely.
It can really help kind of de-escalate the energy in the room.
For sure. Another really powerful tool is setting boundaries.
Okay. We talked about boundaries with clients earlier, but are you talking about also setting boundaries with ourselves?
Absolutely.
Okay.
It's about recognizing our own limits and knowing when to step back and recharge. This might mean, taking regular breaks throughout the day, saying no to taking on new clients when you're feeling overwhelmed, or even just setting really clear boundaries around your availability outside of those scheduled sessions.
Right. It's about prioritizing our well-being so that we can show up as our best selves for our clients.
Exactly. And, sometimes despite our best efforts, a particular therapist-client relationship, it's just not a good fit. And
Yeah.
that's okay.
It is okay.
Yeah.
But how do we recognize when it's time to make that difficult call? Because it's not always easy to, like, admit defeat, so to speak.
It's not about defeat. It's about recognizing that not every therapist is the right fit for every client.
Right.
And that's not a reflection of your skills or your commitment to your work at all.
Okay. So what are some signs that a referral might be in the best interest of both parties?
I think if you have consistently felt unsafe, triggered, or just emotionally drained after sessions, despite implementing all the other strategies we've talked about,
Yeah.
that's a big red flag.
Yeah, it's about trusting your gut instinct
It is.
and acknowledging when a situation is no longer serving us or the client.
Precisely. And remember, referring a client is not a failure.
It's enough.
In fact, it can be the most compassionate and ethical decision.
Right. It's about putting their needs first.
Exactly.
Wow. This has been like an incredibly insightful deep dive. It's clear that navigating this kind of aggressive client behavior, it requires like this really delicate balance
It does.
of empathy and firmness and self-awareness.
It really does.
But knowing that there are like effective tools and strategies out there that we can use, that we can implement, it gives me like a sense of hope and empowerment.
Good.
And for you listening, as you continue this really, really vital, important work, just remember this: you're not alone.
You're not.
Seek support when you need it, prioritize your well-being, and never, ever underestimate the power of your presence and compassion.
Well said.
Thank you so much for taking the time to like really unpack this with us today. It's been a really, really important conversation.
It has been. Thank you for having me.